Okay, well, thank you again for joining me this evening. I promise to be to the point and should have you completed in about 30 minutes or so, maybe 40 at the most. Again, the objective here is to really hit some of the, I don't say some of the high points and then follow up afterwards to address the detail. Myself, my name is Briant Sikorski. I'm kind of like fit the profile of the Midwesterner, I guess, but I was born into a typical, pretty American, oriented family, if you will, traditions, duty, honor, country. And this is in a small suburb outside of Detroit. And we weren't really wealthy, but we weren't hungry either. Unfortunately, my father passed away when I was he was 49 and I was about 17, and that left my mom, myself, my brother, and two sisters, and left us kind of in the lurch here, due no fault of his own, obviously. And I guess I saw what happened in our lives, and I try to do what I can to convey my passion for trying to, I'll say, plan ahead and make sure that the unexpected doesn't happen to them like it happened to me. So I specialize in helping individuals, executives, and small business owners as they approach their peak earnings years and plan for the unexpected while transitioning from accumulating their portfolio to distributing it. And I also use financial planning and retirement income modeling software to help individuals conceptualize what that means as far as them, saving for retirement and then distributing that money. I bring about 20 years of advisory experience, and I have both a accredited asset management specialist and chartered retirement specialist certifications, on top of a master's degree in business administration. I attended the University of Michigan, go Blue, and Oakland University for my respective degrees. Now, today we're going to talk about Medicare, and Medicare is something that's incredibly important, but it's also completely confused, I think. So we're going to learn today why Medicare planning is really a critical component of a retirement plan. And we're also going to talk about the kind of the nuts and bolts. You may have heard ancillary commentary about what is a Part A, what's a Part B, what's a Part C. And we're going to talk about how to help make better informed decisions about Medicare. So we can see our agenda here about concerns, costs, Medicare, Medigap, pros, cons, and future resources. In addition to what you'll get from this presentation, I've got another couple of online places I'm going to show you. So to begin with the very basics, what is Medicare? And Medicare is a federal health insurance program for individuals age 65 and older or who are disabled. And people can receive health care services under the original Medicare plan, Parts A and B, or by joining a Medicare Advantage plan, Part C, and prescription drug coverage, which is covered, and that's Part D. Now, when retirees or elderly or soon to be elderly or soon to be transitioning people have been asked, the rising cost of medical expenses is one of the top concerns for those in retirement. And that is included in outliving our savings, that our investments won't be able to keep up, and what happens if we have a death of a spouse. Now, in 2019, annual spending on healthcare for those 65 to 74 was an estimated $6,772, according to the Bureau of Labor Statistics. And if you take into consideration and lengthening lifespans, it's estimated that couples may need up to $300,000 to cover all of their Medicare premium and out-of-pocket healthcare costs over their lifetime. So it's not just about what healthcare costs today, it's also about what healthcare will cost tomorrow. So we've seen that the beginning of 2023, those that are receiving Social Security are getting an increase in their benefit, but on the other hand, their benefit has been depreciated by historically high inflation. So kind of a double-edged sword in that regard. And the same holds true to healthcare costs. If you have general inflation in groceries and retail, I can guarantee you that it's going to spill over into healthcare as well. In fact, I just went to a restaurant today that I frequent often, and they just put up a new sign, which they didn't do before. What it said essentially, you know, if you pay cash, dinner is $12 or lunch is $10, but if you use a credit card, it's $10.50, whatever the number was. So, you know, there's a business owner who's trying to offset some of the increased costs of credit card transactions right there. So we talked a little bit about the fact that Medicare is fundamentally a health insurance program for individuals age 65 or older or who are disabled. They can obtain these A and B or C for Medicare Advantage or D for drug coverage. Now, the original Medicare program was composed of two parts. Part A, which covers major medical hospitalization, and Part B, which covers everyday doctor services. Over time, each part has expanded to provide more and more coverage, and parts A and B are still the mainstays of coverage today. So Medicare helps pay for insurance coverage for outpatient prescription drugs, and insurance companies and other organizations are approved by Medicare to sell this coverage. Part D is voluntary, but enrollments in Part A and B is required to enroll. And Part D enrollment is required within 3 months of being eligible for Medicare, or there's a penalty, financial penalty. The one exception to that is if the enrollee has prescription coverage under an employer or union plan that is at least as good as the coverage under Part D. So while Medicare is a great benefit, it doesn't pay for everything. That's why most people get some kind of gap coverage. If without supplemental coverage from an employer or union, an enrollee may buy a Medigap policy from a private insurance company. This will help pay for many expenses not covered by Medicare, as well as deductibles and co-insurance. So you can see that we've got Medicare without a doubt, but at the same time, at least in this current flavor, we could have a scenario where we're paying deductibles and co-insurance. Now, again, this is a federal program, but it is regulated by state insurance authorities within guidelines set by the federal government. But since they come from different companies, they may provide different levels of coverage. The premiums can also vary by company, coverage, and by state. And Medigap doesn't cover everything. For example, long-term care, vision, or dental care aren't covered. Neither are hearing aids, glasses, or private duty nursing. There's a 6-month open enrollment period to buy a Medigap policy. This starts the first month that you reach age 65 or over and have enrolled in Medicare Part B. If not enrolled during this time, enrollment may be restricted later and policy choices could be limited or might be offered, but only at a higher price. So again, we're looking at these basic Part A for hospitalization, Part B for doctors, Part D for prescriptions, and then paying that other piece there is either looking at a Medigap policy, and there are 10 different plans to pick from. And these plans cover things like co-payments, co-insurance, and deductibles. And standard plans must all offer the same benefits. So there's really the only difference between the two types of policies are really just cost. And some states are like Massachusetts, Minnesota, and Wisconsin are standardized in a little different way. And we'll take a look at that in a minute as well. So now I want to take a deep breath here because this is where a lot of people get confused. We've talked about Part A, hospitals, Part B is doctors, Part D, prescription drugs. There's this Part C thing that's kind of stuck there in the middle. What is that? Now we can do a Medicare gap policy, which we covered in the previous slides, which will cover certain co-pays, co-insurance, deductibles, etc. But then we get to this thing called Medicare Part C, and in particular, this thing called Medicare Advantage. And this is really key because with a Medicare Advantage plan, it will provide coverage, and this coverage is provided by private insurance companies. So if you think about it, the federal government has essentially offloaded the age risk factor or the health risk factor, I guess, to private industry, private insurance companies who are now taking on and saying that they can do a more efficient, less costly job than the federal government. And we can benefit from that because we can get we can kind of get our Part C plan here in complement to our Parts A and B. And then we can also get other benefits to help cover costs. And I'm going to show you a specific example here in just a few minutes to show you exactly what I mean by that, particularly where you're going to be maybe kind of surprised to see how enthusiastic, if you will, these insurance companies are trying to sell these plans as coverage, and you'll see why in a second. So within this Part C, there's essentially the 5 types of Medicare Advantage plans. And these are health maintenance organizations, or HMOs, preferred provider organizations, or PPOs, private fee-for-service plans, special needs plans, and medical savings accounts. So now again, within that Part C Medicare Advantage plan, it gives you the ability to receive or be part of some of these different types of plans, different types of Medicare Advantage plans. So let's take a look at some of the pros and cons of original Medicare. Some of the advantages are that original Medicare allows you to pick and choose what coverage you like. If you want more coverage, then pay more in premiums. Another advantage is that most doctors and hospitals will accept original Medicare as a form of payment. This allows more access to healthcare across the country. If you're enrolled in original Medicare and then you move to another state, your coverage will remain the same. It won't be deteriorated. Some of the advantages of original Medicare is that it's disadvantages of original Medicare is that it's typically an 80-20 plan, which means that Medicare only picks up an average of about 80% of the cost of care, and you're left on the hook for the rest of the 20% unless you purchased a Medigap plan.
Okay.
Now, this additional coverage results in higher monthly premiums, and also
I don't know.
key
That's
point
how
here
ours works.
is dental and vision coverage
No,
is not included.
yeah.
So a couple of key, issues there that can really make a big difference for you. Okay, let's jump over here. Okay, so now let's look at some of the pros and cons of Medicare Advantage. Now remember, Medicare Advantage is the private insurance company version of Medicare. It has all the same components of original Medicare, but the US government allows private insurance companies the ability to add additional benefits and sell them to the general public. So the pros of Medicare Advantage are that you get all of your healthcare benefits in one package. These plans can also include dental and vision insurance, along with other healthcare benefits not available in original Medicare. Another advantage is that some Advantage plans can also include out-of-pocket maximums to limit your exposure to unexpected medical bills. Some of the cons of Medicare Advantage plans are that if you go to a doctor or hospital that's out of network, additional out-of-pocket expenses may be incurred. And in order to keep costs within the plan, you must go to a doctor or hospital that's in your HMO or PPO network. And another disadvantage is that anything outside of what the plan allows will cost additional out-of-pocket expenses. So I did a little bit of looking here, and I used to live in a small town in northern Michigan. And I remember when we lived there, I had insurance through an employer per se, but it was an HMO kind of plan. And in the small northern Michigan area, there were not that many healthcare providers, particularly when you got into specialists. So if you needed care, you had to travel a couple hundred miles down to Grand Rapids, 150 miles to Grand Rapids, or about 250 miles down to Detroit or Ann Arbor or Lansing, because the local town had a hospital, but they certainly didn't have the latest and greatest when it came to specialty care. So in that situation, let's say you're trying to decide, do you want to take a regular Medicare plan or Medigap plan, or do you want a Medicare Advantage? I can tell you that in this area, there is no shortage of healthcare providers and specialists to see you if you're in a Medicare Advantage plan, which is not the case everywhere. So cost is one of the biggest questions on an individual's mind. And let's take a quick look at those associated with original Medicare. If, like most individuals, modified adjusted gross income, and it's below 91,000 for filing individual and under 182,000 for filing married jointly, then this scenario we're going to go through is typical. We'll discuss what happens later in the presentation if the modified adjusted gross income is higher than these numbers. So Part A is a premium free if enrollees earned 40 quarters and paid into the plan over the Medicare plan over the years. So Part A is premium free if the enrollees earn for 40 quarters. Say that quick. Part B, for those below the MAGI levels, will be around $170 a month. If buying a prescription drug benefit, the Part D premium for your prescription drugs will be in the neighborhood of $30 to $60. The amount will be determined by how robust coverage is and also the state that you live in. Now, the final option is purchasing a Medigap policy. 34% of Americans purchase one, and depending on the plan purchased and how much of the original Medicare coverage gap is covered, the cost can average from $50 to $290 a month. And they can also vary by state. So purchasing all of the above and looking to cover as much of the original Medicare gap as possible is roughly $350 per month per individual. Okay. Now, Medicare Advantage costs vary as well. And depending upon the extra benefits added onto base coverage and the state, this will determine the overall monthly premium cost incurred. The base amount paid will be determined by the Part B premium. For most individuals, that'll be $170 a month. Then depending on the additional benefits, deductibles, out-of-pocket maximums, and state will determine the final cost paid for Medicare Advantage. I'm going to show you something in just a little bit that's really going to change this equation for you. You'll see what I mean. Now, Part B premiums are based on reported personal income, and the higher the income, the larger the premium until it reaches the maximum amount. So you can see, again, like we talked, 91,000 or less individual, 182,000 or less joint, monthly payment 170. And even if you got up above 500,000 singly, it's only 578. You probably heard this quite a bit, and that being the Part D premium, so a prescription drug plan. The premiums are set for the policy offered, and if the income is above a certain limit, an income-related adjustment amount is paid in addition to the premium, and there may be an additional premium cost. So kind of piggybacking on this Part D comment, you probably heard quite frequently, the commentary about, well, if you're going to get any kind of health plan, and it makes kind of sense, whether it's a PPO, if it's a health advantage, Medicare Advantage plan, whatever, you first want to take a look at are your doctors or clinic or your hospital or whatever, are they included in the plan? Number one. Number two then is which Part D plan that you pick, does it offer and are the drugs you're taking now included in the plan, in the policy? So those are kind of the couple things you've got to look at right out the gate, in order to figure out where do you kind of go from here. So you can see why this can become rather overwhelming for someone who's, number one, getting older, looking at getting retired, and then having to pick all these different things of, Part A, Part B, Part C, Part D, what am I doing here? So you can see where it gets very confusing for people. Again, Part D premiums, depending upon income. So here's another real life example of original Medicare costs. So Mary is retired. She's 65 years old, and she has $70,000 in annual income through the combinations of Social Security and a pension and whatever else. For original Medicare with a Part D and a Medigap policy, she would pay nothing for Part A, $170 for Part B, nothing for Part D because it's part of her Medigap, which is right here at $144. So her total premium is $314 per month. So Medigap covers copays and deductibles for Parts A and B, and then Mary would be on the hook to pay for any dental, vision, or any long-term care costs that she were to incur. Now here we got another example. This is David. He's retired. He's 68 and he's got 130,000 in income. So he is electing to go the Medicare Advantage route as opposed to Mary, who was doing the original Medicare. So he's taking Medicare Advantage with prescription drug coverage. He, again, likewise pays nothing for Part A, pays $340 for Part B, and so his total monthly costs are $359 a month. Okay. Now again, I'm going to show you something else that changes that. So you'll also have to be cognizant of what's known as an enrollment period, and there's really two different issues there. And we're going to talk about this enrollment concept because it can be very confusing. So for Parts A and B, if you're eligible when turning age 65, you can sign up during the 7-month period, beginning 3 months before the month one turns 65. This includes the month you turn 65 and ends 3 months after the month you turn 65. If you're not signed up for Part A and Part B when first eligible, it's possible to sign up during the general enrollment period between January 1st and March 31st of each year. If you sign up late for Medicare Part B, you will have to pay a late penalty premium every month for the rest of your life, along with your Part B premium. And your Part B premium will go up 10% for each full 12-month period that you could have had Medicare Part B, but did not take it. You will pay this higher premium as long as you have Medicare Part B, and you may not have to pay the penalty if you qualify for a special enrollment period. You might qualify for a SEP if you had health insurance through your job or your spouse's job when you were first eligible to sign up for Medicare Part B. So, like, I guess in my case, since I'm covered under my wife's policy because she works at Duke, I could right now during this open enrollment period, I could elect to remove myself from, quote, her plan and onto a plan of my own, either as a medical advantage plan or as a PPO. So if you're covered under a group health plan on current employment, there's a special enrollment period to sign up for Part A and or Part B anytime as long as the enrollee or the spouse is working and covered by a group health plan through the employer or a union based on that work. An 8-month special enrollment period to sign up for Part A and B that starts a month after employment ends and when the group health plan insurance based on your current employment ends, whichever happens first. So note, COBRA and retiree health plans are not considered coverage under current employment. So recipients aren't eligible for a special enrollment period when that coverage ends. This SEP also doesn't apply to people with end-stage renal disease or ESRD. Goodness. Oops. So another thing to keep in mind with enrollment in Medicare supplement plans or Medigap plans, a Medigap plan may be purchased without underwriting when enrolled during the first 6 months of age 65 and having been enrolled in Part B. But if this window is missed or there's a desire to change plans during the annual enrollment period from October to December, it may be subject to underwriting, which could change the ballgame quite a bit. Now, enrolling in prescription drug plans is fairly similar to Medigap plans. It must happen during the initial enrollment period or face a penalty. There may be a penalty if enrolled at any time after the period is over and there's a period of 63 or more consecutive days without Part D or other creditable prescription drug coverage. That penalty is multiply 1% of national base premium times the number of months without coverage. And you can change your prescription drug policy each year during the fall window right now from October 15th to December 7th. Every year, there's an option to switch policies during the open enrollment period from October 15th to December 7th. Now, enrolling in prescription drug plans is fairly similar to Medigap plans. Again, it must there may be a penalty, if enrolled at any time after the period is over and there's a period of 63 or more consecutive days without Part D or other credible prescription drug coverage. So here's a few things to consider when deciding which Medicare plan to enroll in. They can include but are not limited to, number one, what are your healthcare needs? Number two, what plans cover those needed services? Do you have any other coverage? What are the costs? What choice of doctors or hospitals do you have? What is your available prescription drug coverage? What is the quality of care that you need? Do you need something that provides you with a convenience and gives you the ability to travel? So if you have any questions about this, I've got two resources I'm going to show you here, and you can always obviously contact me as well. But while we're doing that, let me share a couple things here for you, and you'll see what I mean. So I don't know if that was helpful or more confusing than ever, but I want to show you also that if you want, I mentioned you can, this is being recorded, and you can always go to my website and review this again at a later date if you'd like. So let me stop the presentation here. Okay. Let's open this up. So just as a mental note, this is my website. So if you ever want to know about future events, here's a little events tab I have. I've got some different articles down here that get updated either annually or weekly. And more importantly than anything, here's a link to my YouTube channel where when this is recorded, you can access it. Okay. This is a book called, where did I see it? See, it's Medicare and You 2023, the official Medicare handbook. So you can get this and download this booklet, and it's, last I checked, it was about 50 pages long. Let's look at the index here. But it tells you everything and then some that you, oh, here we go. This is just a subset of it. But you can download this booklet and it covers everything. I mean, everything. It's the one, I think the copy I have is about 35 pages long, but would definitely be helpful if you took a look at that. The other key thing that I wanted to show you in summation here is that this is an example of a Medicare Advantage HMO that has been supposedly designed between Blue Cross Blue Shield and the Duke Health System. And you can get again, you can download information kit here as well. Just by putting in your name, you can download a soft copy. But here's the thing that knocked my socks off when I look at this, and it says, look, we said that Part A was free, Part B was, I think, $140 a month. Part C, they quoted a number, Part D, they quoted a number, but here is a Medicare Advantage plan. And I looked up just for fun, and I found that my primary care physician is covered, my hospital of choice is covered. I also threw in there just some kind of drug prescriptions that could happen as I get older, and I was covered by everything. It was not anything, no concerns whatsoever of not being covered. But zero monthly premium, zero doctor visit copays. I mean, I'm on PPO with my wife now. I have to pay $20 every time. Zero medical and drug deductibles, nothing, none. Zero prescription copays on many commonly prescribed drugs. Not uncommon to be paying $20 a month on something like that now. $20 specialist copay with no referrals, meaning you don't have to go to your primary care physician to get permission to go see a specialist. An annual $3,900 maximum out-of-pocket limit for in-network covered hospital and medical services. So right there, you're capping any of your potential costs. I meant to look this up and I forgot, but free silver sneakers fitness memberships. It's kind of a cooperative between healthcare providers and local fitness centers, but I've neglected to look up the details. And they say over $10,000 in additional benefits. And I can't remember if that's on here, but they also include, it was something like several thousands of dollars for dental care. It was also, I saw one, I don't think it was this example, but it offered $900 a month in healthy food assistance. So here's this, again, you can find this online, but this kind of shows you how to see if your prescription drugs are part of this plan. Is your doctor, attend a webinar specifically on this Medicare Advantage plan. So again, I'm not compensated for advocating this. I'm just saying that I was pretty impressed. Oh, I remember one other one that I just thought of is it also provides $400 in a month coverage for over-the-counter medicines, over-the-counter, herbals and things like that, vitamin C, vitamin D, vitamin E, etc. So with that, I hope I provided you a little bit of groundwork, and you're more than welcome to give me a call, take a look at my my site there that I mentioned, and if there's anything I can do to help you, please don't hesitate. And with that, I'll wish you a great end of your evening with me, and a thank you very much to go with it. All right, take care.